Hey, my name is Ashley Hamilton and I'm a clinic director at Cadient in the Fulton Clinic in Atlanta, Georgia. And today we're going to be talking about how to manage temper tantrums using proactive behavioral strategies. So proactive strategies, what is a proactive strategy? A proactive strategy is a strategy that occurs before a behavior that attempts to decrease the likelihood that that behavior happens. For the purposes of this presentation, we're going to give you a bunch of different strategies that you can use that may help to decrease the likelihood tantrums happen. The first one is functional communication training. So before we can start talking about functional communication training, we have to talk about precursor behaviors and what those are. A precursor behavior is simply any minor behavior that reliably occurs before the big tantrum or the big behavior that you're looking for. And those are the times when you're starting to see those precursor behaviors that you want to intervene. You want to start doing something at that point before it gets to a full-blown tantrum. So for functional communication training, that's a big way of saying that you want to teach them how to ask for what they're wanting rather than communicating through their behavior. So if you think about it, typically problem behavior and communication have an inverse relationship. So if you are able to communicate, you're not going to have to use your problem behavior to communicate as much. On the contrary, if you are unable to communicate effectively your wants and needs, then you're going to use problem behavior a lot more to communicate those wants and needs. So it's super important that we give our children a way for them to be able to tell us what they need in that moment, whether it is a break, whether it is simply attention, whether it is that they want a certain item. So a good way to do this is functional communication training. So here we have Sally. Sally is crying because her brother just took her iPad and she is so sad about it. She is crying here and it hasn't turned into a huge tantrum yet. So this would be the time to intervene. It's not a huge tantrum. Rather than having her go and potentially have it escalate into hitting or kicking her brother for that iPad, we might ask her to say the words, "Help, please. I need help." She says, "Help, please," and then at that moment we can come and we can help her be able to ask her brother for the iPad or a turn on the iPad. Similarly, you can also have her ask for the word iPad. "Mom, I want the iPad." And then you're able to give her the iPad or give her access to the iPad for using her words rather than having it turn into a really big tantrum. The next one is called differential reinforcement, another really big term. So the easiest way to remember this is thinking of this visual that I put here. You want to catch the good, catch them being good, catch them doing things that you want them to be doing and give them attention and provide reinforcement for that. And you want to be specific when you do provide reinforcement or provide praise when they are doing something good. So rather than just saying, "Good job," you might say, "Hey, great job putting the silverware away. Thank you so much." While typically it is a good thing to just provide verbal praise in addition to potentially another reinforcer, verbal praise may not be the only thing that you provide. You may also provide access to a break if that's their reinforcer, or access to an item if they really like something. If you have a child who is screaming, that is your worst tantrum, is just screaming and it's so loud and so high pitched, you want to try to find times where they're quiet and you're able to say, "I love how you have a quiet voice. Give me 5, dude. Way to go." Again, if praise is not their main reinforcer, maybe you give access to the iPad. "You're doing such a good job being quiet. You can have the iPad for a few minutes." And lastly, if you have someone that's hurting themselves, find times when they're not hurting themselves and provide reinforcement then. Using differential reinforcement is going to decrease the likelihood that they're going to engage in that behavior in the future. The use of verbal warnings and the use of a timer can be really helpful. If you set a timer on your microwave or if you use a timer on your phone, there's also many apps that are available. They can serve as a warning that allows you not to have to say anything. Another thing that is super helpful is using the verbal warning. So saying, "Hey Johnny, you have 5 minutes until it's dinner time," if Johnny's on the TV. "Johnny, you have 3 minutes until it's dinner time." And "Johnny, you have 2 minutes until it's dinner time." All right, 1 minute until it's dinner time. And giving them that verbal warning can be helpful to decrease the likelihood that they'll engage in problem behavior. Premack principle, this is something that a lot of people have probably heard of, but if not, it's just the first then statements. So when you're able to give your child awareness of what is coming next, you are giving them the opportunity to be more successful. So saying, first we're going to the doctor, then you can play on the playground. First it's time for homework, then you may have your iPad. This plays really well into our next proactive strategy, which is using a visual schedule. So very similarly to the first then, this gives you a way to be able to show your child what is coming next. So allowing them to see, whether it's very specific or very vague, the tasks that are happening throughout the day are going to give them a sense of predictability to be able to better manage what activities actually come next. Providing choices whenever possible can be super helpful. It allows your child to feel like they have more of a sense of control than maybe they really do. So think about it. We tell our kids what to do, how to do it, when to do it, why they have to do it, and a lot of times that may be overwhelming for them. So if you're able to provide choices in everyday life that allow you to still have control but give them the sense that they have some control, it may be helpful. So even though they still have to get dressed in the morning, they have to take their medicine, and they need to brush their teeth, maybe it doesn't matter what order that happens. So you say, hey, do you want to brush your teeth first, or do you want to take your medicine first? And that, again, allows them more of a sense of control over the situation. Another proactive strategy is breaking down the task and chunking. So the more that we can break down the tasks for them, or quote unquote chunk them into sections, the easier it will be for them to potentially process that information. So if it's a worksheet, if you know that typically doing homework with them is a challenge, maybe when you present the worksheet, you divide it into 3 sections and you give them 1 section at a time. That will decrease how much they immediately see when they look at the worksheet, and then maybe they get a break right after. Then they come back and they have to do just that next section rather than doing 30 problems all at once. Behavioral momentum, which I think is a really fun proactive strategy, is also known as the foot in the door phenomenon. So you want to ask somebody to do more tasks that they're more likely to engage in before presenting the big task that you're asking them to do, that you really need them to do. So if your child really does not like sitting at a table and doing work, but they like to color, what you might do is you might say, go ahead and sit down. They sit down, which is great because now they're at the table, right? Tap your pencil. Cool, they tap their pencil. This is good for you too, because now they have the pencil in their hand. And then you present the demand of write your name. So you're setting yourself up for success setting them up for success because they are, without knowing it, complying with some of the demands that you are presenting to them, and you're getting them closer and closer to the task that you're inevitably going to ask them to do. Proximity control is also a really important proactive strategy. So if I tell my daughter to turn off the TV and get in the shower, or turn off the TV and get in the bath, but I'm downstairs, she is not very likely to follow that instruction because I'm not right there and I'm not going to make her do it. I'm all the way downstairs. However, if I walk upstairs and give her that direction from right next to her, she's going to be much more likely to comply or follow that direction because I'm already there and I'll be able to help her do it if she decides not to. This one is a fun one, using do versus do not statements or instructions. So when we are seeing something that we don't want to be seeing, so I see my child hitting another friend or spinning so fast that they're going to fall down and break something, or climbing on the table, I typically am going to say, no, don't do that, or don't hit, or stop climbing on the table. If you think about those things that I just said, I just verbally said the things that I don't want them to do. So this strategy talks about changing that verbiage around and telling them what to do. Rather than telling them exactly and restating what they just did, let's tell them what to do instead. So if you have somebody who is hitting someone, you might say, show me safe hands, show me quiet hands, show me hands waiting, so that they are doing something that is not hitting, but you're not really going into or saying the behavior that you don't want to see. And then same thing, if your child is climbing on a table, you might say, hey, feet on the floor, and you're telling them what you would like for them to do rather than saying stop climbing on the table. It's important to know your environment and where you are. If you have a child who is really likely to throw things or swipe things off of a table, or push things aside, you may consider what we call sanitizing the environment. And all that means is if you're about to go do something with someone who does engage in those behaviors, make sure that there's nothing around that they could break or that they could throw and really hurt somebody. This one is something that takes a little bit more planning because you're going to want to think a little bit ahead of time. You don't want to be caught in that situation trying to move everything away from your child as they are actively trying to throw things at you. Proactive attention, proactive breaks, and proactive access. So as much as possible, we want to give the things that our kids want proactively so that they're less likely to engage in behaviors in order to get them. So if I give proactive attention, which is me every 5 or 10 minutes being like, hey, Johnny, I love how you're being so quiet, or I love how you're sitting and playing with your sister, or thanks for asking before touching the remote. Those things are going to be super helpful for somebody who really likes attention. You're giving the attention before they're doing behaviors to engage in the attention. For breaks, if you have somebody who just needs a break from work a lot, catch them when they're being good, again, differential reinforcement, and provide a break while they're doing good things. Proactively, before they get to a tantrum, give them access to a break. Hey, you're doing such a good job working on these problems, or you're doing such a good job making your bed. I know you're not quite done yet, but go ahead and take a break because you're really trying hard. And proactive access. So proactive access may be the same thing. You're doing a really good job doing this task that I asked you to do. Why don't you take a quick break and have iPad time for 3 minutes? For somebody who may need more sensory input or somebody who likes to play with sensory toys, you may provide those things again before problem behavior. So before you ask them to do a task that may be a little bit harder, you give them some hugs or some squeezes, or you allow them to play with some fidget toys. And that may help decrease the likelihood that they engage in behavior in order to get those things. I hope you guys had a really great time learning about proactive strategies with me. Again, my name is Ashley, and I work for Cadient. Thanks so much.